Thank you.
Thank you.
Good afternoon. My name is Anton Sebastian Chas. I'm from Tanzania. I'm doing the community health activities, which include the HIV care, treatment services, and prevention. Thank you.
Hi everyone, my name is Ozla. I'm from Turkey. I work for the Y Plus Global, which is the global network of young people living with HIV. I am the Young Key Populations Program Officer at Y Plus, and I'm specifically co-coordinating the Young Emerging Leaders Capacity Building Program in collaboration with GMP Plus.
Good day, everyone. My name is Tandegile Mlauzi, and I work with VSO in Taco, which is formerly Taco Africa. We are stationed at Kami Maximum Prison, where we're doing the prison health program under the Taco program. Thank you.
Thank you so much, my panelists. So, as I mentioned, I'll be the moderator of this session. And may I kindly request that while the session goes on, we try as much as possible to keep our voices lower, especially at the entrance. I think there has been a lot of disruption. So getting into this morning's agenda of this session, I would like to find out uh, from you. We do have Sambo in your daily. Yes, from yes.
Me?
Uh-huh.
Anton.
Pardon?
Excuse me?
No, I wanted to ask a question.
Yeah.
Yes, from you. In your daily line of work, what has been your experience in terms of young people who are living with HIV? What has been your experience to accessing SRHR services? Also HIV and in relation to gender-based violence?
Um, the experience that, first of all, I have about 5 years of experience working in community HIV testing services, which involve mainly key populations. According to my experience, because I've been working in Tanzania and some part of Kenya, the experience there's some things which I've experienced. The key populations have limited healthcare services. So there is a lot of activities taking place there. There is a lot of stigma. There is a lot of discrimination among the key population. That's my experiences in HIV testing services, care, and treatment.
All right, thank you so much for that. I will come back to you once again in relation to what you have just shared with us. But coming to you, like more, what has been your experience in terms of working with adolescent and young people living with HIV, with the major focus around HIV, SRHR, and gender-based violence?
Okay, yeah, thank you very much for the question. So maybe I'll use my personal experience as well as the experience of other children, adolescents, and young people that I work with. So growing up, being diagnosed with HIV was really challenging in my life because of the stigma, the discrimination, and the isolation that followed my diagnosis. And these were very difficult to handle. But one of my greatest challenge was accepting my status. And one of the reasons was a lack of access to counseling as well as mental health services and programs that equip us as young people to have skills, knowledge, and confidence to cope with our HIV status. So I remember in 2008, when I was diagnosed, the situation was really challenging, but it's still the same for many young people living with HIV currently in 2023. So lack of access to mental health, psychosocial support services is crucial to continue to impact their health and well-being. So it really makes it harder for us as young people living with HIV to manage our condition effectively. So this is why we need more investments in mental health programs and support services that can help young people living with HIV to cope with their diagnosis and live fulfilling lives. And as always, just like any other child, growing up, I had dreams and goals, and I wanted to be a doctor. But when I learned about my status, everything changed. I actually thought that with my status, I wouldn't be able to achieve that goal or any other goal I set for myself. So you can actually see that the diagnosis came with a lot of fears and uncertainties about my future, and it took me some time to adjust. So, as young people living with HIV, we need more than just medication to help us deal with emotional and psychological impact of the diagnosis. So we need comprehensive care that includes counseling, mental health support, and mentorship program that can provide guidance and hope for the future. So we need to be reminded that there is life after diagnosis and we can still achieve our goals and dreams. So access to quality healthcare is very critical for young people living with HIV. So this includes access to antiretroviral treatment, regular medical checkups, and support to manage any side effects of medication. However, beyond medical care, we also need access to education, employment, and other opportunities to thrive. So living with HIV should not limit our potential, and we should be given equal opportunities to succeed in life. However, personally, over time, I learned to cope with my situation and sought support from other young people living with HIV who were peer counselors. And this have really helped me to develop a positive attitude towards living with HIV. Hence, today I'm here confidently saying that I'm thriving with HIV, living a full and fulfilling life. But under these young people living with HIV, we do have different subgroups. For example, we have young mothers who are living with HIV who are also facing numerous challenges, including intimate partner violence, you know, the issue of disclosure. Many young people are getting while they don't have enough skills to disclose their HIV statuses to their partners. So this is really leading to the issue of intimate partner violence. And there's an issue of discrimination from other healthcare providers. And another issue is the lack of access to sexual and reproductive health services and barriers to education and employment. So similarly, we also have young people with disabilities who are also living with HIV, who continue to face these additional challenges, such as physical barriers, accessing healthcare services, and lack of awareness and understanding their needs and exclusion. For now, thank you.
Thank you so much, like Mo, with so much information and elaborative way of challenges of people, young people and adolescents living with HIV. Coming to you, Usla, uh, would you share with us some of the innovative ways that you have used of storytelling in terms of advocacy work that you do under the power of my reality?
Yes, of course. As I mentioned, I work at Y Plus, and one of the responsibilities I have is co-coordinating the Young Emerging Leaders Program, which is a capacity building program for young advocates within the HIV spaces. And Y Plus Global is a global advocacy partner of Love Alliance, and this capacity building program is also supported by the Love Alliance. And
Sorry,
we
Usla,
recently
can you raise your
should I?
voice a bit? Yeah, sure.
Okay. Is this better? Can you hear me better? Great. As I was saying, with the support we receive from Love Alliance, we have recently started building a campaign around the lived experiences of young key populations called My Reality. And that is actually the reason we wanted to be a part of the pre-conference, because we started recording, actually finalized recording podcasts with around 17 young people from various countries around the world, most of them from Africa. And actually, we wanted to promote this campaign with you and how this storytelling through podcast was for us and for the young people we are with. And the, what we recorded was their story. I just coordinated this process, and this is also their space. And they're also actually with us today. But because of the time strains that we have today, we could not share this space fully with them. So I'm going to introduce them to you, and I'm going to ask if any of them would like to share their experience, as this is their space and the stories in the podcast are also their stories. So let's go down from the list. We have Elisane from Cameroon. We have Don Darcy from Burundi. We have Catherine from Kenya. We have Lina from Uganda. We have Elibarik from Tanzania. We have Darlington from Nigeria. We have Robert from Zimbabwe. And we have Joy from Nigeria as well. Just because I made an eye contact with them, I'm going to pass the mic to Catherine and ask you what was it like for you sharing your story in the podcast, if you would like to share, of course. And how did you feel? How was it being the object, and how was it being the subject of the story that is going to change possibly the realities of other young people?
In terms of me sharing my story in the podcast, it was a bit difficult because at times we tend to take lightly when you're sharing your story, and maybe you're cracking an egg that you had actually shelled yourself into. But the My Reality campaign really opened a space where you can actually open on the challenges that you face. And mental health, in terms of opening up, most people don't really engage you after to look after your mental health. If I've spoken about something critical that has happened to me, what happens after? Maybe I've opened up something that I was really wasn't supposed to open up, and it has taken me a lot of strength. But My Reality campaign has actually helped me in shaping also my mental health, in terms of accepting who you are, in terms of doing what you love, and also in terms of the advocacy spaces that we are working with. We are empowering, we are pushing for capacity empowerment skills. We need more people to actually hold our hands so that we can pass the batons into for the young people. If I make a mistake, the Young Emerging Leaders program has actually showed us that we at some point need support from other persons. Most people keep on saying young people do mistakes, but when you see our mistakes, hold us hand by hand, let us move together, we learn from our mistakes. Thank you.
Do we have time to get another opinion from one of them?
Yes, you can.
Since you're in Zimbabwe, I'm going to pass the mic to Robert. And I know you're a creative person, so how was it for you being part of this creative process? And why do you think is creative storytelling so crucial for our movement?
Okay, good morning, everyone. So my experience ever since I started this process it really changed me. I got a chance to meet various people, not only from Harare, but from other places. And I was more into mental health and also promoting young key population, especially those living with HIV, that cannot access these services at the healthcare facilities due to the stigma and discrimination they face. So me coming in, I had to partner with organizations that works with Yankee population and sensitizing and addressing the healthcare facilities on the issues based on Yankee population in order for them to access services. Nothing is painful to see a young person living with HIV not taking his medication or her medication due to the fact that he cannot reach at a healthcare facility because of the stigma and discrimination. But with that, I have totally seen a change due to the sensitization that I had with organizations such as Panjia Zimbabwe AIDS Trust. And we saw a positive change that came through it. And mental health as well on the other side, I encourage my Yankee population that it is more wiser to, get to visit a psychotherapist and get counseling, because we're living in a world whereby, due to our culture, we're being told that if you're a guy, if something happens, you're not supposed to cry. A man doesn't cry. But at some point, we are all humans. We do have feelings, and we do deserve mental health services. So personally, I feel like it was a great journey, and I literally learned a lot. And I personally made a positive change as a young counselor, as well as a young emerging leader. Thank you.
Thank you. I think from the previous two presentations, we had mental health coming up, and we continue talking about it. And Catherine also added the challenges related to mental health. So coming to you, Sithandekile, uh, what would you share in terms of engagement with young people through sports for HIV and mental health outcomes?
Okay, thank you so much. We were implementing the program it was a prison health program, and we're stationed in Blawayo, Kami prison, and we dealt with all the various prisons there. So my experience working with the prison population, it was a bit challenging sometimes to reach out to the community. But because of the way the program was set up and the methodology in which we were implementing, through sports, we use drills that do appeal mostly to the prison population, looking at the setup they are in. They mostly sometimes do not have anything to do, but with the introduction of sports and having the additional benefit of lessons coming out of the drills that we're implementing, it was at the end of the day positive, I guess. We got positive impact because throughout the drills that we did, these drills spoke of sexual and reproductive health, they spoke of gender dynamics, they spoke of various relationship goals and the setup of relationships. And so you'd have different people coming out after these sessions, talking to us about some of the reasons why they were in prison, which range from the gender-based violence to some other ills that are there in our society. We managed to say impact in terms of paradigm shifts and other thought processes to think some people didn't think other ways in terms of relationships. So we achieved positives, so many positives, and we managed to impact a lot of people. Yes, thank you.
All right, thank you so much, Sithandekile. Before we open the floor for questions and contributions, Anthony, can I give you an opportunity to also share the work around community health workers and PrEP initiation strategies for young and key populations?
Yes, we know that the HIV among the key population group is very large according to the WHO. Uh, According to my experience, when we are doing the HIV testing services, in order to provide the interventions, we are doing three interventions: the biomedical services, the structure interventions, and the behavior interventions. Our activities based on the biomedical intervention and the behavior, while the government in your country deal with the structure intervention, meaning that they introduce the systems to allow or to expose these key populations in order to be at low risk of getting HIV. Among the biomedical intervention and behavior interventions are done by the different organizations that are supported by PEFRA and CDC. So one among I'm from it, MDH, called the Management and Development for Health. This is organizations which is funded by the PEPFAR and CDC donors. So we are doing the interventions of biomedical and the behavior. So mainly the biomedical interventions in HIV testing services is PrEP initiation. So when we are testing, when we go to the community and find the key populations, we are testing. We are testing for HIV. When we identify this, that someone is HIV negative, in order to expose him to be at the low risk of HIV infections, we enroll him or her to the PrEP services. Then after enrolling her, we just monitored every time. We just monitored. Usually we just monitored by 1 month, 2 months, 3 months, according to the adherence of that client. So dealing with key populations in our African countries is very challenging because our communities do not accept, do not recognize that, oh, this key population belongs, or they have the rights to get healthcare services like us. We know these are our brothers, these are our sisters, they are our children. So we have to understand that there is the equal opportunity of getting the healthcare services regarding the situation. We understand that there are a lot of challenges. The key populations are stigmatized. The key populations are violated from human rights. So in order to reduce all the things in our community, we have to do the biomedical interventions, introducing the PrEP services. As we know, the benefit of PrEP, they reduce the risk of getting HIV when used consistently, timely, and accurately, as we know, according to the WHO guidelines, right? Um, Among the some things which in our activities experienced in African countries, main Tanzania, because I've been working in Tanzania and some part of Kenya, is a stigma, lack of awareness. These two factors cause the key populations to have the limited sources of healthcare services, especially in finding the PrEP services. So we came up with the ideas of making sure that the key populations find the services which are equitable, which are reliable, which are every aspect of which they can make them survive and be reduced at the higher risk of acquiring HIV services. So among the best the activity that we as the community testing services team, we encourage to have the advocacy plan to call for actions. Whenever we go to the community and finding that there is the group of key populations, we have to call the action, immediate call, provide the healthcare services, arranging, find program on how we can save these key populations because they are our brothers, because they're our sisters. We have equal human right of getting healthcare services. So why could we stigma them? So whenever we go to the community, finding that the key population exists, we have to call for action, introducing the programs of which we can live with, we can help these our young brothers and sisters in order to be at the reduced risk of HIV infection. We have to do the advocacy policies right now. As we know, the WHO uses advocacy services, advertising that there is equal human rights of healthcare services, finding donors and other people to fund the program that we call to action. Also, we have to make sure that we get the what I can say the testimonials, because there are some of key population, there are some of individuals use PrEP services. So in order to be to make sure that the community is aware of the HIV intervention services in PrEP services, we have to find the testimony that someone is HIV positive, his partner is HIV negative, and that partner uses PrEP, they get children which are uninfected with HIV. So we should not lag behind these testimonials in order to avoid all these challenges that are taking place in our communities. Also, we as the community health workers, we have to make sure that the trends of monitoring and evaluation of these key populations are revised each times whenever we provide the services. You might feel, I explained that you can go to some community, interviewing the communities. Hey, what's the last time of using PrEP? Oh, I say 3 months is 3 months is back. So the one who gave you PrEP give you another one. So, no, they come and disappear. So that is not the proper way to make the adherence of the PrEP services. Wherever we go to the community, finding the key population exists, we have to monitor them. Go monitor them for quarterly or monthly, providing them, seeking them, allowing them to have the best time of which you can consent her and link to the clinical setting areas. Not only to the PrEP services, uh, being a key populated group, you suffer from a lot of challenge. You suffer from sexual harassment. You suffer from different challenges, and these people they according to the situation of they can fear to tell someone, oh, I'm having maybe the STI disease. I'm having maybe some diseases because of discrimination. So whenever you are a community health workers and going to the community, discover that someone may be having different disease, just link them to the clinical service. You will make him proud. You will make him aware and avoid all type of stigma that exists in the community setting. According to my experience, that's all I can say. That we community health workers, we have the great role. We have the great role in our community to save these behaviors, or to save our brothers and sisters. We are all equal. Thank you very much.
Thank you so much, Anthony, for sharing the strategies of uh, PrEP initiation for young people and key populations. So at this juncture, I would like to invite questions. If we can take maybe 3 questions, and then my panelists will be able to respond. I see there's a hand there. There's one there.
Hello. Okay. Thank you very much. The name is Jenzo Wata, a UNICEF youth scholar. Pertaining to the issues which are affecting young people, which have SR, HR, we've got issues whereby people who have STIs try to open up, and then there are those people who would like to take advantage of their situation and try to use their situation and their vulnerability for exploitation, maybe of their body, of their services. This is an issue which is starting to arise as the campaigns and the awareness to help people open up arises. So I would like to ask, how best can we tackle this and catch it in its tracks before it gets far?
All right, thank you. There's another one here and another one over there.
Thank you so much. Once again, I'm Sharon, and maybe I would like to ask on the PrEP initiative to say how then are we making sure that we're advancing this knowledge to people, because now I think we have the vaginal ring, which acts as the PrEP, and now we have the injection, right? But how many people do know and understand that, for example, maybe a married woman can go and have a vaginal ring without the husband knowing which is a PrEP? So I think there's still more that we need to do as individuals, from the grassroots and even from the families we're coming from. I'll take, for example, within my circle, people still have misconceptions about maybe discordant couples. People still think that you can even, you are at risk. Of course, you are, but they don't really understand to say, how do you balance maybe if you're a discordant couple, what happens when you want to give birth, etc. Right? So I've been taking that initiative to go and learn. So maybe this is also a call to everyone in the room to say, let's always research, let's always be learning. There are courses, short courses that, for example, in Zimbabwe, the University of Zimbabwe offer on HIV management, and there are no limitations to who can attend these classes, and you can attend for prices that are quite reasonable. So maybe my question would be, how then are we making sure that everyone understands about the latest information? And another thing is also to say, how are healthcare providers being friendly to people who are coming? For example, you want PrEP or you want PEP. How are they even explaining? I'm disappointed. I went to one pharmacy some other time and I'm like, because I was still doing this program, I'm talking about HIV management. So I wanted to find out, is everyone, I get into a pharmacy and I'm like, I want to buy PEP. And then she's like, you can't even buy PEP. There are so many things that we need to consider. You have to go to the clinic, etc. But then I'm sure there's a limited time that you're supposed to access this. Maybe it's a Friday where I'm asking for this at 4 p.m. and then now I have to go to the clinic on Monday, and then the time lapse is already, you know, by the time that I go to the clinic, I have to get tested. I have to go through some processes, and maybe the 72 time frame which I'm supposed to access the PrEP have already lapsed. So I think there are still more gaps that we need to address to say anyone should access PrEP and PEP at any time, considering they have A, B, C, and D, which is actually practical, because some people wouldn't want to go to a public hospital for them to access. Maybe I just have the $10 I want to go and just pay and get. So I think this is some of the information that we really need to make sure that young people have. The latest information should be even on our social media platforms, in terms of maybe, did you know statements? Did you know that now there's an injection that you can get and you are covered maybe for the next 3 months, etc. So I think this is a call to say we still have more to do as individuals, within our families and communities, and wherever we find ourselves in. Thank you so much.
All right, thank you so much. Let's just take the last question and then my panelists will respond. There was a hand over there. It's been up for the longest time.
Thank you, Milton Kiaba from Zambia. There's just a few contributions that I want to make to this topic of discussion. Immediately, we know the the reduction of HIV in here. We are being taught, and at the same time, it is our opportunity for us to know what we do not know. And when we know, then it means we should disseminate the information to the people that do not know. I'm happy that the curriculum was revised in 2013 and they included the comprehensive sexuality, which becomes an opportunity for the children in schools to learn about uh, STIs and HIV. Now, it remains our part as youths, not only in here, but also outside there. I'm sure we can do more better by having community sensitization. Community sensitization, we can go as far as rural areas, not only rural areas, but we can also go into schools. So having school talks, it will be able for us to curb this vice, because HIV by now, it is the most affected people are young people. And you can agree with me that when information is disseminated to young people, it will be very easier for them again to disseminate and be open to uh, uh, to to see these health facilities for them to seek information. And not only that, the most biggest thing that we should do is to take ownership. in as much as we know or we learn information about the sexual reproductive health rights, we should take ownership. Even when somebody is the one suffering, be empathetic by providing solutions. Because when we are empathetic, it'll be very easier for us to provide solutions, and we'll be able to find means and ways for us to keep the vice. So are just some contributions that I wanted to make. Thank you.
Thank you so much for all the contributions and the questions. Over to my panelists if you would like to shortly respond to some of the questions that came up.
Thank you so much, my sister, for your contribution and some major question about the PrEP services. The first challenge that I put into action is the awareness of PrEP services. Um, when you pass through data, including from the WHO, from different UN organizations, the advocacy is very low. That's why nowadays there is more advocacy, the use of social media, because we here youths, we cannot maybe spend time maybe in watching some things. You may find that we are all here attending the conference while passing in different media, right? So the among awareness is through social media, the advocacy, use of social media, use of influencers, the musician. You know, I always been challenging. I am personally a medical personnel with little skills in advocacy. When I am going to community, I know I'm less skillful in advocacy. I use the one healthy approach. I'm taking the social worker, I'm taking the pharmacist, I'm taking the clinicians, I'm me myself a laboratory scientist. So when we use the one health approach, advocates will be beaten, and the community will have the knowledge of PrEP services.
All right. Thank you so much, Anthony, for your response. Is there
She
still
has
another one?
2 years.
Okay, if you can just keep it a bit short because we have run out of time.
Okay.
All right, thank you.
Okay, thank you very much. So I want to respond to the question which was raised by my brother over there, but I would want to thank the speaker who contributed from that corner, who actually tried to respond to that question. So I will not repeat what he said, but I want to emphasize on the importance of self-care. When we are actually looking for health services, or maybe when we are infected with STIs or in other infections, what we really need to understand is people will always say something, and people will discourage us, and people will comment negatively upon our lives. But what we need is that our initiatives or our programs should mainly focus on equipping us as individuals on ways to copy with these negative attitudes or comments that we receive from other people. And also, we need to understand that our health is our responsibility. So we should prioritize ourselves more than what other people are going to comment regarding our situation. Thank you.
All right, thank you so much. And with that,